Frustratingly, with this disease, there are very few early signs and symptoms. One of the most reliable ones is rectal bleeding, and so it's so important to take that seriously. Rectal bleeding, usually bright red blood, or it can be a maroon-colored stool, is a sign that there's something going on inside. Other things can be things like weight loss as well as abdominal pain, although those are less common when the disease is early. That's why colonoscopies are so important to get screened for. What we do for that is we find these early precancerous polyps and remove them at the time, and that way they don't have the chance to form into cancers. For people that have a right-sided colon cancer, so colon cancers that are located at the first part of the colon, we do what's called a right hemicolectomy. So we take out the colon as well as some tissue that's normal below it and some tissue that's normal above it, and then we put those two ends together. For people that have a left-sided colon cancer, or a sigmoid colon cancer, what we do with those folks is exactly the same thing. Take a margin of normal tissue above, a margin of normal tissue below. The other important part of doing operations in this area is taking the lymph nodes as well as the blood vessels that feed the cancer. We make sure that we have those lymph nodes, not because they in themselves are important, but because what they do is, after we see under the microscope what they look like, if there is cancer within them, we can decide if patients need chemotherapy or not. For rectal cancers, the treatment is to go in and take out that part of the rectum, and then to take out the lymph nodes and the blood vessels as well down there. We only talk about things like colostomies or ileostomies if we're worried that there's not enough of tissue beyond the area in order to put things back together. I think the most important thing is that not all bright red bleeding is hemorrhoids, and to be sure to get checked out by a professional, because rectal bleeding is never ever normal.